Good day everyone, I am Kauyuri May Amisidro, a nursing student from Tarlac State University, and today I am going to perform hand washing technique. So first, what is hand washing? Hand washing is a primary weapon for infection control arsenal, or in simpler term, hand washing is used to eliminate dirts, microorganisms, germs, and bacteria that are found in the hands. The primary purpose of hand washing technique is to eliminate the risk of infection and to reduce the risk of cross-contamination between the client and the healthcare practitioner. Hand washing in healthcare setting involves steps such as assessment, planning, implementation, and evaluation. For the assessment, you need to assess yourself as a healthcare practitioner and you need to assess your patient. By assessing your patient, you need to determine the following. First, presence of increased susceptibility of infection and the possibility of undiagnosed infection. Second, check if your patient undergo any treatment that penetrate the skin or body cavity. Check if your patient take any immunosuppressive medication. And lastly, check the current health status of your patient. For the planning, you need to know the location of your faucet and your soap. Also, you need to ready your materials such as your faucet. Make sure that your faucet will produce a warm running water. Also, you need to prepare your soap. You can use any kind of soap such as bar soap and liquid soap, but as of now, I will be using a liquid soap. And also, you need to prepare your disposable paper towel. For the implementation, you need to assess your hands. Make sure that your nails are trimmed short, and I already trimmed my nails. And make sure that you don't wear any kind of jewelry such as rings, watch, and bracelet. And also check if your hands are free from cuts and hangnails. My hands are already bare, so I think they are ready. And if you are going to perform hand washing where the patient can observe you, make sure to introduce yourself and explain to them why do you need to perform this procedure. For example, "Good day ma'am, I am a registered nurse at this hospital and I am going to perform hand washing technique because it can reduce the risk of cross-contamination between you as a patient and me as a healthcare practitioner. When it is time for you to turn on the faucet, take note that there are different kinds of faucet. There are hand-operated handle, elbow control, knee lever, foot pedal, infrared control. But as of now, I will be using a hand-operated handle faucet. So, as you open the faucet, take a control on it and make sure it will produce a warm running water. Now, rinse your hands. Now, wet your hands and your wrist. Make sure that your hands are lower than your elbows so that the water will flow from the hands into the fingertips. Now, apply an appropriate amount of soap. I will be putting a coin-sized amount of soap that will be enough throughout the procedure. Use a firm rubbing circular movement to wash your palm, the back of your hands, and the wrist. Also, include the heel of your fingers. And then, interlock your fingers and your thumb and move them back and forth. However, World Health Organization recommends steps such as right palm over left dorsum while fingers are interlocking with each other, and do it vice versa. Palm to palm while fingers are interlocking with one another. Back of the fingers while fingers are interlocked with each other. And do it vice versa. Also, right thumb over the opposite palm and do the circular motion. And do it vice versa. Continue this step for approximately 6 seconds. And then, Include the heel of your fingers, do the circular motion. Now, rinse your fingers and your wrist. Take note that your fingers must be lower than your elbow so that the water will flow from your hands into your fingertips. After rinsing your fingers, you need to pat dry them. Take note that one paper towel is only appropriate for one hand. Pat dry your hand. Then dispose. Get another one to pat dry it again to ensure that there are no moist. Next, get a new paper towel for the other hand. Pat dry it, ensure that there will be no moist. And if it is time for you to close the faucet, get a paper towel to grasp for the handle, then close it. Then dispose it properly. Next, for the hand washing before any sterile skills, grab a surgical brush, put a liberal amount of soap, rinse your hand, wet them up to your elbow, and then make sure that your hands are higher than your elbow so that the water will flow from your hands into your elbow, and it will ensure that your hands are cleaner than your elbow. Then, using the surgical brush, scrub the top of your hands. Scrub your nails for approximately 10 strokes. Scrub your fingers. Scrub the side of your hand. Scrub the lower, upper, and the middle part of your arm. And then, rinse the surgical brush. Put a liberal amount of soap. And do the same procedure from the other hand. Scrub the top part of your hand, starting from the nail, on your fingers, on the side of your hand, and in the lower, middle, and the upper portion of your arm. After that, you need to rinse your hands well. Make sure that your hands will be lower than your elbow so that the water will flow from your hands onto your elbow. This technique will ensure that your hands are cleaner than your elbow. And then, grab a paper towel to pat dry your hands. Again, take note that one paper towel is only appropriate to use for one hand. Then grab another one to ensure that there will be no moist on the hand. Then, grab another paper towel for another hand. Ensure that there will be no moist. Grab a clean paper towel to grasp for the grip of the faucet to close it. Make sure that you wear gloves before touching any sterile equipments. For the evaluation, ensure that your both hands are clean. Good day everyone! So today I am going to perform the donning and removing of sterile glove open method. The purpose of this procedure is to enable to handle sterile equipments without contaminating them and to reduce the risk of the transmission of any infectious organisms from the nurse's hand to the client, high risk at infection. This procedure needs to undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, you need to check your client's record in order for you to be able to know what are the procedures that are going to be performed with the use of sterile gloves. Also, you need to check your client's records and ask your client if he or she have an allergy to latex. If possible, you can use non-latex gloves. For the planning, think through the procedure. Plan on the things that you must need to do before putting any sterile gloves. Next, prepare all the materials that are needed for the procedure. Be sure to have an extra glove for availability. Also, you need to assemble your materials. Make sure that you will have a pack of a glove. And then, for the implementation, first for the preparation, make sure to have a glove that have a right size for you. The glove must be snug but not so tight. Also, be sure that the sterility of your gloves, try to check the sterility of your gloves. Just like the sterility of this glove lasted until 2024. So now, as you continue the procedure where the patient can observe you, introduce yourself to the patient and validate your patient's identity. Also, explain to them why do you need to conduct this procedure and on how they can cooperate throughout the procedure. Also, prior to any procedure, you need to conduct a hand hygiene. So, we will use an alcohol. Also, provide your clients privacy. If it is time for you to open the outer wrapper of the glove, be sure to peel down it to open, and be careful because you will be needing to leave the inner wrapper of the glove into a dry, clean place. And then dispose the outer wrapper, and then as you open the inner wrapper of the glove, make sure that the glove will be close to you. And now, as you open the folded part of the wrapper, be sure that it will not hold back so that the gloves will not be contaminated. And then, take note that your dominant hand will be the one for the first glove. You can insert it by the help of your non-dominant glove. Grab the folded cuff and then try to lift it by the help of your thumb and the first finger of your non-dominant hand. And then, slowly insert your fingers into the glove. Take time as you insert your fingers into the glove. Be sure that your fingers are away from your waist and your body. And then, it is time for your non-dominant hand. By the use of your sterile gloved hand, place your sterile glove hand under the folded cuff. And then, lift it away from the table and your body and slowly insert your non-dominant hand through this glove, through the second glove. Then, take your time again. Make sure that your sterile glove will not be in contact through your skin. And then, adjust the gloves to fit the fingers. And then, make sure that your hands are waist and elbow level away from your body. Also, when it is time for you to remove the glove, make sure when it is time for you to remove the glove, there is no proper way on how to remove the glove. You can do it by this, and this, and you need to dispose it properly, especially when it is spoiled gloves or soiled gloves. After that, you need to document all the sterile techniques that have done throughout the procedure. For the evaluation, you need, and lastly, you need to apply a hand technique or hand hygiene technique before proceeding to another procedure or to another work. For the evaluation, you need to follow up your patient to check if he or she is doing well, and you also need to take note that all the sterile equipments are available for the next healthcare provider. Good day everyone! So the next procedure that we are going to perform is the donning and removing of sterile gloves close method. The purpose of this procedure is first to enable to work in a sterile field and enable to handle sterile equipments without contaminating them. Second, to ensure that the patient will not be contaminated from the nurse's hand, arms, and clothing. Just like the other procedure, this procedure needs to undergo steps such as assessment, planning, implementation, and evaluation. For the assessment, you need to check your client. You need to check the client's record in order for you to be able to know what are the procedures that are going to be performed with the use of sterile gloves. Next, you need to check or ask the patient if he or she has a latex allergy. If possible, you can use a non-latex glove. For the planning, think through the procedure. Plan on the things that you needed to do first before putting a sterile gloves. Next, determine all the needed materials throughout the experiment. Make sure to have an extra glove for availability. Second, assemble your equipments. Make sure to have a package of glove and sterile gown. Next one is the implementation. For the preparation, make sure to check the sterility of your gown and your glove. And for the procedure, prior to the procedure, you need to introduce yourself to the patient. Also, ask the patient's identity for validity. And you also need to explain to them why do you need to conduct this procedure and on how they can cooperate throughout the procedure. And prior to any procedure, you need to perform hand hygiene technique. In here, we can use an alcohol. And also, you need to provide your patient's privacy. When it is time for you to apply your sterile gown, first, you need to open the package of your sterile gloves. Open the outer package of your sterile glove so that the inner wrapper will be placed into a dry clean surface. Through this, it will ensure the sterility of the glove. And then, dispose the outer wrapper into a proper disposal. And then, when it is time for you to apply your sterile gown, you also need to unwrap your sterile gown. So, you need to place your sterile gown in a dry clean surface so that it will so that the sterility will remain. And then, as you unwrap your sterile gown and your sterile glove, make sure to perform hand hygiene technique. And then, it is time for you to put on your sterile gown. As you put on your sterile gown, make sure to grasp it in the neck part area and then move it away from you. Let it unfold by himself. Make sure that it will not touch anything, including the uniform. And then, put your hands into the sleeves. Make sure that your arms will move partway through the sleeves without touching the outside part of the gown. And then, make sure that your arms are at the waist level. Your hands, work down your hands. Make sure that your hands will only reach the proximal edge of the cuff. And then, have a co-worker to tie your gown. Assume that there is a co-worker that already tied out my gown. Assume that there is a co-worker that already tied my gown. Let us now proceed to the procedure on how to put a sterile gloves. Next one is we need to unfold or unwrap the sterile wrapper of the sterile gown. While unwrapping the sterile wrapper of the sterile glove, make sure that our hands are still inside the sleeves of our gown. Make sure that as you unfold the folds of the gloves, it will not go back to ensure the sterility of the glove. And then next, as you need to put the first glove into your non-dominant hand, so it will be the left hand. By the use of your dominant hand, grasp the opposite glove by the use of your thumb and index finger through the sleeves and put it in the opposite sleeve, while the opening of the glove must face throughout the fingers. And then, by the use of your non-dominant hand, grasp the upper part of the cuff, and then slowly enter your fingers through the gloves. Make sure that you will not touch anything so that it will remain sterile. And then, by the use of your non-dominant hand, stretch the gloves so that your fingers will be more comfortable as the gloves are already inserted. And then, you need to make sure that your hands are already comfortable inside the gloves, and then you need to pull up the sleeves so that your fingers can adjust. So this is okay now. And for the dominant hand, by the use of your gloved hand, grasp the cuff insert your glove hand into the cuff of the remaining glove and slowly put it in the sleeves, and then slowly enter your fingers through the gloves. Make sure that it will not touch anything for the glove to remain sterile. And then slowly insert your fingers through the gloves. Make sure to pull off the cuff so that your fingers can adjust. And then, pull the cuffs. Make sure that your fingers are already comfortable, and then pull up the sleeves. Prior and after your donning of sterile gloves, make sure to have a co-worker to check if make sure to have a co-worker to check if you are already gowned, if you are already covered. Have a co-worker to check or to make sure that your gown is already tied up. Let us assume that I have a coworker who already checked my gown or who already adjust the fit of my gown. After that, remove both of your gown and your glove by the means of your gloves. You need to remove them by turning them upside down. By turning them inside out, and then dispose it. Also, your glove, your gown, you must remove them properly. And then, you need to dispose it. Next one, after conducting all the procedure, you need to document all the sterile techniques that you have performed throughout the procedure for the evaluation. And after that also, you need to perform hand hygiene technique before proceeding to any procedure. And for the evaluation, you need to double check or you need to follow up check the patient if the patient is doing well, and also you need to ensure that the next healthcare provider will have an appropriate materials for the next procedure. And that's all. Thank you.